So this session is on community-based participation in using low-cost sensors. My name is Kofi Amegah. I'm an associate professor at the University of Cape Coast, Ghana. And I'll be doing this with my colleague Sietske from Clean Air Fund. She's the Chief Impact Officer at Clean Air Fund. We have three speakers. One from Rwanda, another one from Uganda, and then one from Ghana. They will present their stuff to us for 10 minutes. And then when we are done, we'll open it up for a discussion for another 20 minutes. So let me hand you over to my co-chair to introduce the first speaker.
Thank you, Kofi. So the first speaker today is Mr. Abdou Safari Kagabo from the University of Rwanda.
Good afternoon. Thank you so much. My name is Abdou Safari Kagabo from the University of Rwanda. My work is the assessment of person exposure to particulate matter among the furniture manufacturers. Next. This work has been done in Kigali, Rwanda. Kigali is the growing city as one of the African cities, in development. And growing cities characterized me with many things like the traffic emissions, the construction activities, the commercial and the residential activities, industrial, and so on. As you see on the second picture, there's one of the locations in Kigali in 5 years before and now, which is very constructed. So the construction following with other activities, urban activities, are very on fast growth within the city. Next. So we assess the exposure of an urbanite. A person in the city like Kigali, he is or she is either, you can find her or him either at home or at work or any other microenvironment. Any other microenvironment, we say that other microenvironment, transport, shopping, recreation, or so on. So you can find him, or let's take me as an example. You can find me either I'm at home or at work or any other microenvironment. So we divided the day into 3 microenvironments: work, home, and other microenvironments. Next. So the person exposure is critical in urban areas, but can be quantified with either the spatial-temporal variation of individuals' activities, but also the variability in the concentration, air pollution concentrations, in the PM concentrations. But our objective generally was to assess the personal exposure to PM in wooden manufacturing industries as one of the activities that's been done, that's been doing in the city of Kigali. But we assess this PM, the assessment of the exposure to PM on these manufacturing industry workers in Kigali based on the most visited microenvironments, the 3 we stated. Also, we based on the time spent. There's the time spent at work, the time spent at home, or maybe in other microenvironments. But we based on the PM concentrations. The person exposure we measured, and the ambient air. The ambient air pollution we have. Next. So how did we do this? There is, in these wooden manufacturers in Kigali, they work in the area we call the IBC, a integrated business center. We set a center or a business center, an area, and the basic activities are dividing the smaller activities, including the wooden manufacturing, the welding things, and so they combine together in what we call the integrated business centers. And they are found in many areas within the city. So we took 4 different IBCs, 4 business centers, with 1 represented by each participant. We took 4 participants, 1 in each IBC. And each participant were supposed to wear the portable sensor, and that portable sensor were near the breathing zone, and it was supposed to wear the sensor within 24 hours. So we took 4 corresponding participants because it's with 4 IBCs. We collected the data for 5 consecutive days in dry season. So we took the person exposure data using the pocket PM sensor, and also we considered the ambient air with the existing fixed monitoring stations. The time each participant has spent in each microenvironment was recorded using the time activity diary. Next. Next, please. Okay. This is for the pocket sensor that a person should wear or put on for 24 hours, whether it is at work, at home, or any other microenvironment. So we used also the fixed monitoring stations. They are across in Kigali everywhere. There are not many, but they are located. And the wearable sensor and the fixed monitoring station, they are correlated somehow with high correlation. So we used them to measure the exposure of the participants that working in that area, but with the whole day, either in ambient or the person exposure measured by the wearable sensor. Next. The IBC or integrated business center, where the wooden manufacturing activities are held, they are characterized, all of them, they are common characteristics you have in IBC. There is a significant number of people in and out of IBC. They are all located near busy roads. The more pollution sources can be found in and out the IBC. In either the wooden dust, the welding fumes, emissions from diesel engines, there are many activities that are being done in IBCs. And out you can see the vehicular exhaust near the busy roads, the restaurants and kitchens, because IBC attracts many activities to be done near the location where the IBC is. Next. We assessed 5 consecutive days in dry season. But as I said, our day has been divided into 3 microenvironments. A person visited home, were at home, went to work, and other microenvironment. So the pattern in blue is when the person is at home, a participant is at home. Red, when he is in other microenvironment, and the black is when he is at work. So we have a pronounced variation and higher concentrations when we are at work, but lower concentrations when we are at home. These are the 4 PM 2.5. But when we look at this, the high variability and the high concentration is at work, and the low at home, but all are above the WHO guidelines of that line, which is in green, the set by to save the human health. Next. So the PM10 is the same. The difference is that some values at home are above the below the WHO guideline, but work and other microenvironment mostly, and some for home or above the limited or the said right for. Next. So why? So the high levels we see at work than at home is that we have many activities at work that are generating the PM, which are the woodworking operations, like machinery usage, other processes involved. But home is always a bit less variability compared to the workplace because of relatively stable and controlled in the environment that can be observed at home compared to the work. Yes, next. Usually, and most of the time, all the reports that estimate the health risks, they are based on ambient air most of the time. And when you look at the wearable sensor, the concentrations measured by the sensor we are wearing is higher than the one we are using we are having for ambient air. So which is sometimes underestimate the risks or the health risk related to PM by using the ambient air. So next, my time is almost over. So we recommend, so we conclude by what we have seen. Next, please, the last slide. So we recommend, because urbanization has become an irreversible trend, we recommend to develop and reduce the policies aimed to reducing air pollution, of course, but further studies also employing many participants and many activities should be done to know actually which how exposure is in urban area based on many activities that are being done, not only the ambient air. Thank you so much.
Thank you. Our next presenter is Fidel Wabinyai from AirQo, Uganda. You have 10 minutes, sir.
Yeah, thank you. I'm called Wabinyai Fidel Raja, and I will be talking about participatory air quality monitoring in African cities. Co-designing sensors. So AirQo, this is just a brief, you can go to the next, but AirQo is just founded in 2015 at Makerere University. Next, since I have only 10 minutes. All right, so I'll be mostly talking about Lagos, how AirQo added the design for Lagos City. So we go to the next to the next slide, please. All right, so we looked at why do we look at hyperlocal network for acceleration action? We said, all right, increasing access to air quality data in the city through new and participatory approaches for delivering high resolution monitoring network for Lagos, and using contextual evidence to expand the understanding, awareness, and appreciation of air quality issues in the city to inform action and advocacy. Next, please. All right, so one of the things that we always try to adhere to the general convention rule, like location versus site. So when you're doing this, you should understand what is the location and what's the site. So you may find that the site just where you plant the device, the location may be the whole area. I'm not so good with Ghana, but let me say there's a big place here. We can have like 2 devices, but those are now sites, but the location is kind of larger area. And then the approach should be science-led. You don't just wake up in the morning and say that there and there. So you should have some data and scientific evidence why you need that. So the different pollutants behave differently. I think most of us have already discovered that the site characteristics can be influenced by what you're measuring, ozone, PM values, or the NO2s. So also the sites, we can have urban background site, source-based monitoring, and exposure monitoring. Then the population distribution. So, and lastly, the logistical consideration. What are the availability of the long-term? I think there was that long-term questions, and also security. Sometimes these sensors can disappear. Yes. The next. All right, so at AirQo, this is our pipeline, how we design. So we design our locally based, we do collocation with the reference monitor, and then those devices, we store them in our cloud base, and we have our platform where we have this information available to the public. Yes, the next one. All right, so in our participatory, the AirQo experience, what we always try to start with is contextualizing the urban air pollution. What are the profile? What are the planning needs? What are the existing data for specific city? And then number two, the partnership and community engagement. So who are the people involved, the local communities, the government, the researchers, maybe the local communities, and all that. You have to think of that. Then from there, when you have your community member engagement, the partners, you can now start the site selection. Where do you think these devices should be located? Now, we also, at the end, when you pick the sites, you do now the installation in those different sites. You may pick more, but due to the needs and the logistics, what are the sites that you're installing? And then finally, we have it on our platform, and you can have it for the general public. Next, please. So contextualizing air pollution, as we go to the next slide. All right, so in this, I look at the pollution profile, like I mentioned. What are the policy frameworks? Because different cities or different countries have their own planning priorities. There's some areas that take precedence over the others. So you can't just bundle every city. So you have to know exactly what to expect. Then what are the existing gaps in data? So in that selected city for this, we are basically now going to talk about AirQo, Lagos. So from there, you can now start thinking of the prospective sites that you are going to put those devices in. Next. All right, so here is one of the existing data gaps. How do we sort some of these? These are some of the questions that you check the public available data sources. So some of the platforms that are there, and then existing publication. You take time to look into, there are some great publication out there. You have to do that and look for it. This is a LCS for our Lagos people. So that's where we placed some of the devices. Yes. All right, so in the partnership and community engagement for collaborative siting. Yes, please. All right, so what we think about the landscape. The landscape, like the government, so here maybe the city council, maybe the states, and then the development partners and civil societies, organization, academia, universities, other researchers out there. Private sector, if you can work with private sector, that's also wonderful. And then the general public. So now, if you map all these different, including the government and any other, we believe that you can get a good picture of that particular city that you are in. Yeah. All right. So one of the things we did, that's Dr. Rose. Yeah. So one of the things we did as with Dr. Rose, I know you're going to hear the name so often. So create a buy-in by the leaders. So I believe Ghana already has mentioned that there are people in the authorities, the urban authorities that already want work to be moving on. And the same thing with Nigeria. And then align with the physical planning regimes and local priorities. Each cities have the planning regimes. And then the regulatory requirement. Some cities may be having their own requirements they need. So for that, you have to understand that going forward. Yep. Right. So also we met the research community. Some of that the research communities have the data that, and then also you create synergies. Maybe there are 5 different researchers doing something similar. You bring them together so that you can do something about now the devices. Some place device for 2 weeks. Probably some others are placing device for a longer time. Now that synergy can align with the others so that you can get better understanding from their perspectives. Yeah. All right. So also at the end, we had workshop at Lagos, where now from this workshop, it gave us the ideas where these devices should be placed. Then in this discussion, we reflected on Lagos air quality monitoring, what is happening, what has been there already, and then the synergies from the different projects across different universities and also LCS. So in that, we also looked at the stakeholder and citizen science and the private sector, identifying the type of place of interest for the priority location, because you may want to place 100 devices, but there are some priority locations that you will need to add in. Yes, next please. Right. Then in the workshop also, we got the local needs and the knowledge of the land, because AirQo is in Uganda. We need to know exactly how Lagos is, engagement and ownership, so that UNILAG can take it, LCS can take it and own this project, because we are looking at the long term. And then capacity building, we had some training, inclusivity and building trust. Trust is important. You don't need to hide your things. When you put trust out there, trust will be given back to you. And we believe that will work for everyone. Yep. So, and then consolidating the monitoring site and defining the needs for Lagos. So from the workshop, now we have this site. Yep. Next, please. At the beginning, there were over 40 possible sites that we generated due to data-driven solutions. In this, we looked at the pollution sources, then the representative locations. There are some must-have places. Maybe in your needs, you want schools to be a must-have, near road, must-have market. So what are those must-have places? And then the relevance in the policy, the different policies that you have, plus making sure that the community, this community, we mean the researchers, universities, schools, the local populations. Yeah. So the next. So in our collaborative and phase sensor deployment, here there's some photos. So we have deployed 12 sites. I think we're adding more. Yeah. So Dr. Rose said there are now 14 as of today. So that is Nigeria Photo Authority, and then the Nigeria Institute of Medical Research. So if you want, this is our website, platform.airco.net. You can reach on that. The UNILAG, Muchin, LCS, all these are locations that we have already deployed. Next, please. So out of this process, there are some limitations that we must be aware of. Yes. So I'm just going to mention in logistics, shipping this product from one place to another, and then possible mitigation. You can probably use volunteerism. Your students can volunteer to carry some of these things. You don't need to pay them when you're moving places. You can collaborate with stakeholders. You adopt a phase approach like we are doing with Lagos. We don't put all of them at once. You phase them out. Next slide. Well, there's also conflict of interest. You have seen that some people want location. You have like 2 sensors, but there's some people want location A, not location B. So how do you do that? You seek a compromise because you know you're looking at phased approach. And then power imbalance. When you have the community, there's a local leader, and then there's a professor, there's a doctor. Sometimes the local leader will be like, the professor knows more than I do. So you make sure that you understand this power imbalancement and make it deliberate to everyone. Yes. Finally, the general rule is that every location is a potential candidate for air quality monitoring, but finite resource may dictate the monitoring resolution. So you're not going to place everywhere. Yes. Thank you.
Thank you.
Thank you so much. So we go to the final speaker of the session, which is Mr. Kelvin Yeboah of Breathe Accra.
Hello, good afternoon. My name is Kelvin Yeboah from the Breathe Accra project. I'm the community engagement officer. So today I want to share the project with you, basically our community approach, engagement approaches that we've been using. So So the vision of the Brief Accra project is to address the worsening air pollution problem in Accra. So we want to also look at the health impacts of the air pollution in Accra, and then also identify vulnerable populations, and then look at how we will develop or design tailored interventions for those groups. Okay, but then we believe that to achieve this purpose of clean air for all, we need to adopt a community-based approach where we bring together the community and then help to address this issue. One of the approaches that we've been using is a collaborative data collection, where we believe that the best approach is an active involvement and then also collaboration with the community. So as the previous speakers have said, local authorities within these communities. In view of this, we've established a network of air quality monitoring sensors that have been strategically placed across the Greater Accra Metropolitan Assembly. But then the deployment of these local sensors is mainly influenced by the structure of the community. We know that every community has at least a hospital, what we call the local authority schools, a marketplace, residential neighborhoods. So we look at this and then it's influenced the local sensor deployment. Next, please. Yeah, so this is our deployment map. We want to deploy about 80 local sensors across the Greater Accra Metropolitan Assembly. In the meantime, we've deployed about 46 of them. We have a blend of Clarity, Air Notes, and then AirQo devices, as well as a few reference grade monitors. Next, please. Yeah, so as I pointed out earlier, we've placed some of these sensors at these core or main facilities that form a community. So you can see one of the AirQo devices being placed at a school, and then one at a neighborhood, and then a marketplace. Next, please. And again, we believe that it's not only about deploying sensors, but it's also about training these community leaders and then people who make up the community in how to read or make meaning from the data that the sensors are producing. So in view of that, we've built the capacities of the municipal health and environmental officers of these beneficiary assemblies, and then the transport officers, the planning officers, and then we have plans to also build the capacity of these officers from DVLA, that's the Driver and Vehicular Licensing Authority in Ghana, and then the GPRTU, which is in the body that is in charge of transportation in Ghana, and then DFIU, the Department of Factories, and then Department of Urban Roads. And then with these workshops that we've already had, the workshop covered a wide range of topics, including how to even identify hotspots in these assemblies, how to read the data from our website, how to analyze and how to interpret the data. Next, please. Yeah, so another approach that we have is data sharing platform. So we have a user-friendly website that you can access real-time the air quality situation in Accra. So when you check out your location on the website, you are able to read what is going on, the air pollution levels in the area or the vicinity that you find yourself in. We believe that this does not only benefit individuals, but then it also benefits policymakers and researchers. Next, please. So this is an interface of our website, briefaccra.org, where you have all our sensors located. So when you click on any of the sensors, you'll be able to see in real time what is going on in your area. Next, please. Okay, so another interface where we have historical data in maps and then other visual aids to make it meaningful. Next, please. Okay, now we also have a couple of plans that we want to embark on in the coming days. One of them is to move from the municipal assemblies to the electoral areas. And then also we want to train the assembly leaders in these electoral areas as we did for the metros or the municipal assemblies. And then also embark on radio visits to advocate and then educate for clean air and then the health impacts of air pollution. And then also we want to recruit students. We want to recruit students, and then these students will serve as volunteers and then will campaign for clean air in their schools. So it will lead to the creation of air pollution clubs and then a few of it. Also, we want to use public art and then visual aids or campaigns to campaign for clean air in Accra. Next, please. Okay. This, of course, is not without any challenges. We face a couple of challenges as we embark on this community-driven exercise. One of the main challenges is maintaining active participation from the community members. So there's a difficulty in trying to encourage active participation and leadership, especially when people have other pressing daily concerns to think about. Yeah, for example, there's flooding, food insecurity, harsh economic hardships, and then also breaking cultural barriers and beliefs. Here, we heavily rely on biomass fuel for food. Yeah, that's because it's readily available and then very cheap as compared to the LPG, which is the required or the recommended fuel to achieve clean air. Next, please. Also, maintaining long-term commitment is another challenge. It's a very big challenge when the initial enthusiasm wanes. So when we first go to these communities, they are happy, and then as time goes on, the enthusiasm dies down, so it becomes a challenge. And then resource constraints. We've mentioned the cost of maintaining the local census, especially with the license or the subscriptions. At the end of the year, or you have to pay subscription to continue on getting the data from these local sensor developers. Okay, so the way forward is we want to adopt a community-led initiative where we encourage support we can encourage and then support a community-led initiative to empower local residents to take ownership. As I said in the beginning, that if we want to achieve clean air, we can't do it alone. We need to involve the community. So we have to encourage and support initiatives, community-led initiatives through training and then capacity building programs. And then also we want to involve the youth. Because you can't do anything without the youth nowadays. Next, please. Yeah, and then we want to also leverage highly on social media influence. We have a lot of influencers on Twitter, Instagram, and Facebook. We want them to get involved in advocating for clean air in the Greater Accra Metropolitan Assembly. Next, please. Next, please. Okay, so in conclusion, we believe that ensuring clean air is not a one-sided responsibility, but a shared responsibility. And then through active community participation, we can all take a step closer to the dream of clean air for all in the near future. Thank you.
Okay, thank you. Can we have all the three presenters here, please? So I am my co-chair now. We have opened up the discussion. So if you have any burning questions, you can just raise up your hands. We'll walk up to you with the mic and then you can ask your questions. We have 20 minutes maximum to do this. Okay.
Thank you so much for your presentations. They're very, very interesting. I heard a lot about engaging with the community, and I heard a lot of buzzwords, but I was hoping you could say a little bit more about some of the substance and detail behind that engagement. When you went to go install the sensors, or when you connected people with those monitors, what were some of the responses that you were hearing? Were people receptive to it? Were they confused by it? Did they have sentiments and expressions? And I'm curious to hear a little bit more about that, and whether you're doing any work to capture that, because I think that that's perhaps some of the most interesting stuff, but I'm biased.
Okay. Yeah, we can start from Brit Accra.
Thank you for your question. So in the beginning, when we approached them, they were not too receptive. Yeah, they always say that we've been briefing the air for years without any complications, and then all of a sudden you come and tell us that the air is sadly polluted. Even up to now, a lot of them still don't believe that the air is polluted. Yeah, so what we actually want to do is, as we've said, every community has, there's a hierarchy. So we move from the people who are in direct contact with them. In this case, that's the assembly members or the assembly leaders. So we go to them, and then these people will listen to them. They listen to them. So we try to engage them. But then we first try to let them personally understand the issue at stake. When they understand, they can actually advocate for the other community members to understand.
Yeah, thank you. Like he mentioned, we always need to know how the hierarchy of the community is. And also the researchers, some of them have already done work, they have buy-in with the local community. So once you meet all these needs, it's easy to easily move into the community and they understand what you're doing. This is not Lagos, but in Uganda. One time there's a gentleman who said, you guys, if you had not come to me, my people would have beaten you, because they thought we had put video cameras to see what they're doing. So it kind of helped to know that there's a local leader who already knew about air quality. And once you are there, you move to him and he will take you around and everyone will accept your devices. Yes.
Okay, I want to share an experience from Kigali. Most of the time when you approach a participant, you say this is a sensor, you have to wait just to see your exposure on air pollution. To say, what is air pollution? So I know you guys always, when you come, I don't know what is in your device. Maybe it's a camera or something that senses me for 24 hours. So it is challenging. Most of the time we use our friends. So the friend who work in the same place and also who work in the same activity, and who knows that you can't do bad things to him or her. And then we approach, we explain what is going on, what the work is doing is very sensitive to the health. And when you approach him and is accepting to do the work, he can explain to other friends of him. So that approach is the one we used when we come to the person directly, who you don't know, whether he can understand you. Sometimes they refuse to accept your things, but we start from the friends, and then friends explain others, and you know what you are doing.
And I must add that there's a similar story where we try to install one of our sensors. The only place we could get was a police station nearby. And then even the police themselves, they were not at ease. But then not everyone, for example, there are some of the neighborhoods, the house owners, they are receptive. They actually want to house these sensors in their neighborhoods.
Hi, I'm Alicia Olago from Code for Africa. Thank you so much for the presentations. So my question is, what kind of participatory methods do you use to engage the community so that they feel like they were actually part of the decision-making process in terms of deploying those sensors?
Okay, so we'll take 3 questions, and then the ones that you are comfortable with, you can answer in the interest of time.
Right, thank you very much. The idea of driving air pollution advocacy to communities is a very tasking one, because it appears members of the public are yet to clearly understand that air pollution results in terrible diseases, including those who are in the medical field. They are yet to accept the fact that air pollution is responsible for most diseases. Just about last year, we asked for a grant in Nigeria. And the grant was on air pollution-dependent morbidity and mortality. We have medical consultants in the team. And they challenged why we would say that air pollution has effect in the death of people. I'm talking about consultants. And they asked why we could even seek for such funding. I was taken aback. I was really surprised. In fact, they even went further and said, would you ever see a medical doctor write that a person died because of air pollution? The air pollution is not a cause of any death. So it was quite challenging for me because I couldn't understand. So I think that for us to drive the advocacy for air pollution, we need to actively engage the medical professionals. They need to clearly understand that it is true that air pollution is a leading risk factor for most respiratory diseases. And that people have, even though air pollution may not be directly responsible for most of the respiratory diseases, for instance, or heart diseases or liver, but air pollution will exacerbate those conditions and lead to death. So that it would be important for medical personnel to also diagnose the cause of those diseases and also mention in cases where people are exposed to, air pollution, to also indicate that air pollution is also responsible. I remember somebody was saying here that, people don't seem to believe that air pollution has any effect, because they will ask you, they will say, my grandfather was breathing all the smoke and dust, and they live for very long. We all laughed, but this is the basic conception, the basic perception of the generality of the people. So is there any way we can connect these professionals so that they understand this message of air pollution?
Okay, thank you, thank you. A wonderful commentary. Thank you very much.
Thank you very much. I think I'll go to the first speaker. after you have deployed your personal exposure sensor to the various artisans and obtain your results, what did you tell the artisans?
Any hands up? Okay.
Thank you. I want to ask if you had experienced at all being asked to pay some money before you'll be allowed to deploy your devices, or a particular group asking you to pay, or even the particular person that will be monitoring for you for security purpose. Have you ever been asked?
Okay, so let's start with the gentleman from Kigali on what you tell the artisans when you put your sensor in there.
Thank you. After my results, and as you see, even if you have chosen those people working in wooden manufacturing, the project was big for even other IBCs across the country, and most of them were the same. Actually, because I started by saying I started with my friends, and the friends, after results, I go, you guys, you see how much time do you spend at work? You see that is 8 hours as recorded. And you see that your levels, you actually spend much of your time of the day breathing the air, which is not good. And how much time have you spent in this work? Say, for example, 1 year or 2 years working in the same area. So, do you breathe well compared to maybe other people you are living with others? Most of them said actually is not the same. So I see you guys, you are responsible. You're responsible for your life. You have to take measures because your exposure is too high. So the answer is I go back because I know the participants I used. Most of them were my friends, and I informed them personally, because before even taking these measurements, you have to ask for permission. The institutional review board, before they give the permission, they said, after your results, you have to go back and inform what of the people have you are tested with. So it is a must to go back and inform the participants what you obtained in your results before you do any other thing and recommendation.
So let's move to the one of the other questions that was just asked towards the end about, have you ever experienced having to pay money for deployment of devices for security?
Yes, sure. You see these people on the streets. Yes.
Shall we try Kelvin for this one? Is that okay? No.
Not that I can think of, but then what we do with our deployment, as we said, is through the training of these officers, we've actually made them to understand that the sensors are not just there to get data for us, but then is to inform us so that we can help them on educating them or trying to design interventions for those solutions for those problems. So they kind of own the sensor. Yeah, the officers that we've trained, they own the sensor. They go around once in a while to check and then report to us if maybe the sensor is not at the place that we put it. And then also we have our website. So whenever they don't see readings from the website, they prompt us and then we go in and then take a look at it. But we've actually not been charged money to place a sensor. We just have to go for permission before we put the sensors.
Thank you. So I think we are coming to the final question, which is on community-based approaches and kind of bringing the community in for decision-making as well. Do you have any experience you can share on that?
Yeah, thank you. So with the community, one thing we should understand is that participatory approach is not just a one-off, because you're going to go back to the community from time to time. And one of the things at AirQo that we do is the community does not just mean only the people in the villages. We categorize the community to be researchers, to be civil societies. So in this, you'll find now you have a better idea of how to deploy this, where to deploy these devices. So once you sit down, you pick the locations, and I'm curious also about these medical doctors. So probably we have been not thinking about them that much in our discussions. So going forward, we should be adding them. So this is a continuous approach. In fact, at AirQo, what we also do is, let's say we have deployed 50 devices. With the next process, we have device optimization, where now we try to move these devices to maybe different locations from the results that we already had. And that means you're still going to do another participatory approach in that community where you think now the device will encourage more, or maybe the device has better. When you optimize, instead of 50, maybe you want to reduce to 30, depending on the funds, or maybe you want to increase to 60, and you move around the devices. So the participatory approach, it's number one, you categorize who the community are. And number two, you just don't stop. You will have engagements, continuous engagements with them. And what we have also seen with the AirQo devices, they are, probably you'll see some, they blend with the environment. They're not too bright. So most times, once you place it, even some people may not know that it's available or it's around, but they'll see the data and they will know that they have device in their locations. Thank you.
Thank you so much.
Okay, so thank you. If you didn't have an opportunity to ask your question, you can engage them during the reception or during the breaks. We have another exciting session coming up. Thank you for your attention.
Thank you.